Hi, I'm Mayor Josh Cohn. I'm grateful for the opportunity to introduce this excellent video made by Councilwoman Carolina Johnson, supported by Nicole Levitsky. The video features two MDs residing in Rye, Drs. Kerry Murphy and Andrew Pearle. My thanks to all involved. My message is simple. Please watch and listen. As the doctors will tell us, we're sheltered in Rye. We're living on the edge of the war zone that New York City is becoming and that we may experience too. I receive many complaints that not all of us, particularly younger people, are not observing social distancing. We're all vulnerable, all ages, and we all must make a team effort, young and old, to beat this. Parents, please understand that COVID-19 is not kidding around. Please ask your kids of suitable age to watch this video. Please observe social distancing, wash your hands, and don't touch your face. It's simple stuff, but it's effective. Now, please enjoy the video and stay safe.
Welcome to a special segment about social distancing on Rye TV. My name is Carolina Johnson, and I'm joined today by Dr. Kerry Murphy, an infectious disease specialist, and Dr. Andrew Pearle. He's an orthopedic surgeon. Thank you so much for joining us today and helping us educate our fellow Rye residents on how important it is to distance ourselves from our friends and during this time. So I'll start with Kerry. If you don't mind telling us what's going on at work. What kind of patients are you seeing, and what's the situation like?
Well, I mean, if anyone's watching the news, you've seen that New York is certainly the epicenter of the epidemic here in the US. Our hospitals are all full of patients with COVID-19. We have had to expand our ICU capacity. So what used to be operating rooms is now ICUs. What used to be clinics is now a hospital floor. So we've ramped up to accommodate for the number of cases that are coming in, which every day over the last 2 weeks has increased. And that is representative of pretty much what's happening in every hospital in New York right now. So we are in we are certainly seeing a surge in cases, and this continues to be a major strain on the healthcare system and worrisome for, our ability to care for everyone, which is one of the reasons why social distancing is so important, because if we can limit the number of local spread, the amount of local spread, then hopefully we can keep people out of the hospitals so that we have the ability to care for those that need us.
Dr. Pearle, what's the situation over at your place?
So I work in the city at Hospital for Special Surgery, which is an orthopedic-only hospital. We're right next to New York Presbyterian, and basically the virus has commandeered our hospital. So we have transformed from an orthopedic hospital to a hospital that treats a lot of COVID. We have a COVID essentially unit. We've converted our ORs to ICUs, and we're treating COVID patients in the ICU, in the ORs now. We're still doing orthopedic surgery, emergent orthopedic surgery, so it's as if we went from a hospital that was a orthopedic-only hospital to a hospital that has 3 distinct units, one orthopedic, one COVID, and then we're also trying to take patients from New York Presbyterian who are on their med-surg floors and treat them at HSS so that we can decompress some of their volume.
And some of the, I want to demystify some of the myths and distinct them from the facts. We initially thought that these virus would affect mainly people with that were older, advanced age, and people with pre-existing conditions. Is that the case? Is that what you've seen most of the time, Kerry?
Well, the majority of patients that are critically ill and getting admitted, a lot of them are older. A lot of them have pre-existing medical conditions. So that's not untrue, but the thing that is surprising to us is that we're actually seeing a lot of younger patients, people without chronic medical issues that are coming in as well, that are also having very severe disease. So this doesn't seem to be that, you know, if you're under a certain age, you're protected and you don't need to do what everyone else is doing. It's affecting everyone, including kids. So this idea that if you're older and you're high risk, meaning you have chronic pulmonary disease, cardiovascular disease, you're the ones that have to worry. That's not true. We all have to worry, everybody. We're seeing 30-year-olds, 40-year-olds, 50-year-olds. I'm not a pediatrician, but I know from colleagues that there are kids getting admitted with this. So it doesn't discriminate. So that's something to be aware of in terms of everyone doing their part to keep each other safe.
Dr. Pearle, at home, what are some of the precautions or protocols that you have instituted so that you can keep your family safe?
Well, I think the biggest thing that I'm trying to tell my family and friends is to not touch your face, basically. You know, I think that the majority of cases we seem to be learning are transmitted by people's hands to their face. Now I've washed my hands, so my hands are clean now, but touching your mouth, touching your nose, touching your eyes is how the disease is transmitted. So if you can learn to not touch your face with hands that have not been cleaned with Pearle or with soap and water, it's gonna really keep you pretty safe. I think it's a very good idea to wear a mask, not necessarily because the mask limits transmission of some aerosolized particles, but because it trains you not to touch your face. So I've urged my family and my friends, when you're out in public, wear the mask and get used to understanding where your hands are. If you're going shopping, you wear a mask. You can touch things when you're shopping, but before you get your hands near your face, wash them, use Pearle, and then you can go about your normal day.
Some of the complaints we hear in the municipal government are, for example, people, joggers or runners who run very close to somebody else who's walking on the road, or bikers or something like that. What would be your recommendation, Dr. Murphy, for people who are running close who encounter a runner coming behind them unexpectedly?
Right. So, I mean, just to acknowledge it's not easy to do this, right? We all want to see our friends. We all want to be with our family. But this is the one thing we actually have control over right now, is where we are physically and who we're with and how we carry ourselves in public. So we all need fresh air. We've got to get out. All of a sudden, there's so many people home at the same time. So it's hard to stay away from people, when you're out for a jog or for a family walk. But, if you see a large crowd of people walking down the street toward you, try to take a different route. Try to run on the other side of the road if it's safe to do so. If you, drive up to a public park and it's crowded, choose a different place. So you want to try to, 6 feet is this number that we all hear about. Try to, stay as far as you can from other people in a public space to protect you and to protect others, because even though we feel well, we may, we know that some people can transmit when they're asymptomatic. And it's sort of, the one thing that we have control over is try to limit our exposure to others and our distance to others.
And if somebody comes close to you, then just wait until you get home, wash your hands before you touch your face, like Dr. Pearle.
I think it's fine to say, like, I wish we could, have a longer conversation, but we're just trying to be safe. We're going to just kind of carry on with our bike ride. Great to see you. Hope you're well. There's a nice, and everybody understands. There's a nice way to say these things. And, but yeah, to just sort of, and obviously, when you get back home, especially if you've had close contact with somebody, wash your hands. Wash your face, don't touch your face, don't touch your face. Those are, things that we can do, that we have control over.
Dr. Pearle, you have teenage kids, and this seems to be a segment of the population that is tough. I was, talking to my husband, and we thought having teenage kids at this point would be the most difficult. Some of them maybe just got their driver's license, they're ready to go, they want to see their friends, they want to hang out with their friends. How do you communicate with your teens? I mean, they see it up close because you're a doctor and you're in the fight, but how could you communicate? What are some pointers you can give out?
Yeah, I mean, I just want to make one comment about this. It's, you know, we have these kind of alternate realities that we're living in. So if you're living out in Rye and you're social distancing and nobody around you is sick, it doesn't quite seem real. And then you go to the emergency room or you go to a hospital where we're treating these patients, and it really is a war zone. So I've tried to communicate that to my kids, at what we're looking at. When I go in and I go to New York Presbyterian right next door, all the ORs there are ICUs. And not only are they ICUs, they've got 2 patients in 1 OR, and they're using anesthesia machines as makeshift vents. Makeshift ventilators. We're getting to the point that if ventilators aren't available for somebody in the OR, we're not intubating. And by me, I'm saying my colleagues at New York Presbyterian are not intubating patients because they don't have a place to put them. And so I think it's really important to communicate to people that what you see on the streets of Rye is not the reality in the hospitals, and it's not the reality in New York City. And we're sheltered in a lot of ways from what's going on in our hospitals. So I tell my kids that they have to remember that if they prevent the spread, they're going to make our life easier at the hospital, and they're going to basically save lives of people who are going to the hospital. That's the weird thing about this. If you're not seeing what's really happening in the hospitals, then it doesn't feel real. So the battlefront, the front lines is the hospitals, and it's really something that people who are walking the halls of the hospital we've never seen in our lifetime, and we never thought that we would see. And so trying to bring that reality back, I think, is important. It may not resonate with a 16-year-old who just got their license, but I think that it's important to communicate that reality as best we can to them.
Which is why I'm so grateful and why I wanted to have you both here today to talk about these and how important it is, so they don't see some name on the news that they don't know. These are people who people in Rye will see you at Starbucks or at the Rye Y or walking around town, and I wanted to bring it to their attention that this is a real emergency situation. Kerry, as temperatures go up and we may see number of infected patients go down, people will let their guard down. What is that dangerous?
Yes, incredibly dangerous. And I think that's sort of our concern on the medical side about, lessening restrictions on social distancing too soon, because we haven't even seen the peak yet. There are lots of people that are getting infected that may not be symptomatic yet. The weather is going to get nice. We don't know whether this virus is going to be less infective or that we'll see less cases like we do with the flu with this virus. Not all viruses have temporality to them with seasons. So, we have to really look at the data and the science to guide our recommendations on when we can, get back to normal life. So, it's going to get nice. We can get more fresh air, but just do it in a socially distant manner, and, just try to do your best every day to keep all of us safe. If we all do our part, then hopefully, less people will get infected, and then we can sort of hope to see the curve go down. But even in countries where this epidemic started beforehand, we've seen, another surge in numbers of cases. So we don't want that to happen here, where we're finally starting to get maybe some control over it, and then people start going back to old life, their old life and what they used to do, and then we start seeing a rise in the cases again. So we want this to go up and down and out.
Dr. Pearle, one other concern we hear sometimes is the people who do the lawn maintenance use the leaf blowers to finish up their job. Is that a real concern? Because I think that there's some myths and some fears that maybe we can, alleviate in people's minds.
I'm not an absolute expert on that. My colleagues who are on the front lines at New York Presbyterian have really stressed the fact that that the disease can be aerosolized and it can be transmitted that way. But most of the time they've seen it transmitted through direct contact, meaning you put your hand to your face. You touch something that's infected and you put your hand to your face. So the idea that it's magically in the air everywhere, I think we should practice social distancing and be 6 feet away from each other. But the way I at least talk to my family is I really stress that you shouldn't be touching your face unless your hands are absolutely clean. I think there's a lot of rumors out there. There's a lot of misinformation. The truth is we don't know. We don't have perfect information, which is one of the scary things about this. I try and keep it simple and give the advice to keep your hands away from your face. I do like the idea of wearing a mask, again, more for training. And the simple, 6 feet of social distancing, I think is a pretty good rule. But the scary thing about this disease is we're learning kind of on the fly.
In essence, we need to control what we can control. Each one of us under control the number of times we can wash our hands, how well we can wash our hands, and stay away from our faces.
I think that that advice is powerful advice at this point. Look, the social distancing is very important. I'll give you a story about a couple of my colleagues. They were actually in a different part of the country. They came back for a funeral, and everybody practiced social distancing except the wife of the deceased, and she gave everybody a hug and a kiss because she was so distraught. And about 15 people from that funeral, maybe it was 10 people, got infected. 2 of them wound up on vents. So this stuff is very real. It's very kind of random. There's a Russian roulette, aspect to it that's really scary. I think one other comment needs to be made, and that is that it's a small percentage of people who wind up critically ill from this disease. But even if you're not critically ill, it is a really scary thing to go through. And some of my colleagues are going through it now where you get sick. You can be a healthy young adult and get really, really sick from this. You don't necessarily have to be hospitalized, but the viral infection, it's a respiratory infection, it can go on for 2 weeks. Chris Cuomo's going through it, and it's an agonizing 2 weeks because you know that anybody around you is at risk for getting infected, and you're always wondering whether you have to go into the hospital and whether you need supplemental oxygen, or you're going to be one of the unlucky ones who winds up needing a ventilator at this point, which is really terrifying. So even if you think you're young and healthy, even if you think your parents are vigorous and healthy, they can still get really sick, and they can live for 2 weeks with this concern that, one, they're infecting people in their family and their community, and 2, that they don't know which way their disease is going to go. So it's usually 7 or 8 days before the viral pneumonia component to it really hits. So it's a really terrifying thing to go through. Even if you come through it on the other end healthy, those 2 weeks are really, really scary. So I would encourage kids to take this seriously, to know that if their parents get sick or if they get sick, they're probably going to be okay, but it can be a really, really traumatic thing to go through.
Dr. Murphy, I have a friend in Greenwich whose husband has gone through the symptoms. He tested negative, but their doctor said treat it as it's a positive. because they start to feel better, and then the fever comes back again. Is that what you've seen, or what you've
Yeah, I mean, like it with any test, there's always what we call a false negative rate. So even though the person has all the symptoms, they might test negative. And we actually are retesting people in the hospital because the presentation of this disease is so classic. Everyone is coming in with cough, shortness of breath. Some people have diarrhea, fever or not. They have characteristic findings on their chest x-ray. And if they test negative, we treat them as if they still have it, and we retest. And oftentimes it'll come back positive. So, if you're in the community and you end up lucky enough to get tested and it's negative, but you are in a pandemic situation and you feel you have the classic symptoms, it's still a good idea to isolate yourself and, take those precautions, because more likely than not, you do have it.
Finally, for both of you, Dr. Pearle first, is there anything that our local government should be doing to, anything more that we should be doing to help out?
I mean, I think that the government can play a role in enforcing the social distancing, to be out and about, making sure people aren't congregating. The story that I told you about the, kind of tragic funeral is a good example of how these clusters seem to happen. So if you see a bunch of people clustering, together, you could have an asymptomatic person within that cluster who spreads it and creates something that becomes a big issue. So just being out and about, spreading the message, not to be scared, but to, practice caution, practice social distancing, make sure you wash your hands, don't touch your face. All those things are important. And so by being out and about, I don't mean going out and congregating, but making sure that people aren't congregating and being on the streets, making sure that you're not seeing anything that is potentially a source of a cluster outbreak.
How about you, Dr. Murphy? Any other thoughts?
Yeah, I think I agree with that. I mean, it goes a long way if one of our government officials, whoever, somebody that's part of the Rye leadership is passing along that message as well. So, it always helps to have reminders. It may even help to just put up signs in places. I don't know I haven't really been out a lot in town, but just reminding people that, like, you shouldn't be here with a group of people, keep your distance, that kind of stuff, just to kind of keep it in mind. And if there are groups of people that are congregating, they need to know that they're putting the community at risk. Even though you're well and young and you're still living in a community, you're still living with your family, all of us have the potential to get infected, especially more so if we're in groups. But I think, just kind of having a presence and reiterating the message. It's now we're going on a long time here, and it's getting harder and harder for people to do this. So just to kind of remind everyone that it's a team effort, and everybody can do their part, and this is a big one. So if we can all try to keep our distance, we will see improvement. Sorry.
Well, thank you so much for joining me today. I wish you well, and please stay safe and know that we really appreciate everything you do for all our fellow New Yorkers in saving their lives. Thank you.
Thank you.
Thanks so much. Stay safe.
All right. Thank you. Thank you so much. That was great.